Technology's double-edged sword. In this video we will explain to you how technology's double-edged sword can affect your healthcare practice.
Recently, we came across a remarkable article talking about small hospital CFOs
taking a back seat on upgrading technology for revenue cycle as challenges with EHR upgrades, MU and ICD-10 are taking away all their money and focus.
Some of the findings highlighted in this article are:
2/3 of hospitals polled in 2012 that intended to replace their RCM platform with a comprehensive solution still had not upgraded by 2014.
Black Book's third quarter study found 83% of financial leaders at hospitals under 250 beds expect their RCM systems to become obsolete by 2016 if not upgraded.
51% of small, under 250-bed hospitals plan to delay RCM upgrades until after the ICD-10 deadline in 2015.
Small hospital CFOs list ICD-10 coding and electronic records integration well above claims and billing.
Now, as we know, technology is a double-edged sword. If not handled correctly, it can cut your pockets both ways.
But if handled appropriately, it can certainly reduce your costs both ways.
But do you know why CFOs consider EHR and ICD-10 as key priority and compromise on upgrading RCM platform or technology?
This is because they fear more revenue loss due to integration issues and possible massive rejections from peers due to transitional phase of ICD-10.
Most hospitals have two challenges while implementing or bringing any change in technology for revenue cycle management.
First challenge faced is the financial burden required in terms of licensing costs for new software. Second challenge is human resources required for implementation, training, transition and accounts receivable follow-up.
Most hospitals don't want to experiment with outsourcing as they can't let go their existing staff members. If they try to outsource by hiring additional resources, it would require more funds on top of technology investments.
This creates a chain reaction in terms of investment required to implement new RCM technology. I would like to highlight one of the low-hanging fruit that most CFOs should consider. It has been observed that denials from peers have increased over the past 2 to 3 years.
It is recommended to create an accounts receivable task force or audit team that identifies denied claims and puts them into an organized strategy for follow-up.
Those claims that are not paid for following reasons: payer doesn't have claim on file due to EDI issues. Payer has denied claim for authorization issues even though authorization was taken. Insured information is incorrect. Claim applied to deductible and non-covered services.
Most of above denials can be resolved effectively by dedicating RCM task force to make a phone call to payer or patient promptly. These kinds of denials are easy to outsource, and hospitals can negotiate an aggressive rate towards outsourcing these calls to payers or patients.
There are other categories of denials such as required appeals for medical necessity, request for medical records, and required appeals for inclusive procedures that should have been paid separately.
A hospital's key knowledge denials team can focus on categories just named. They should implement a necessary action and outsource the follow-up part to an outsourced team.
With proper planning on accounts receivable follow-up from peers, hospital CFOs can easily bring in additional 10 to 15% revenue that can help in funding this technology transition.
In fact, such planning would be required even more during the ICD-10 transition. We would like to end our note with a statement: money can find more money.
We may have to first find our lost funds to discover more of it from technology or automation. For more details and outsourcing accounts receivable services, kindly contact us. Clinicspectrum, empowering cost-effective workflow. Thank you for watching.